The next item of business is a members' business debate on motion 18735 in the name of Annie Wells on World Chronic Obstructive Pulmonary Disease Day. This debate will be concluded without any questions being put. Can I ask those members who wish to speak in the debate to press the request to speak buttons now? And I call on Annie Wells to open the debate. Ms Wells, please.
Thank you, Presiding Officer. Firstly, I want to thank members from across the Chamber for signing my motion and allowing a debate on this important issue. Today marks the 18th annual World COPD Day. The main goal of World COPD Day is to raise awareness for COPD worldwide. This year's theme, All Together to End COPD, highlights the fact that many people are involved in the fight to end this disease. At every stage and at any age, there is an opportunity to prevent or treat COPD. From care providers and patients to family members and employers, everyone can make an impact. That is vital as there is currently 300 million cases of COPD in the world, with the disease being the third leading cause of death globally. And closer to home, Presiding Officer, COPD is recorded to affect 141,110 Scots, with many still undiagnosed. Chronic obstructive pulmonary disease, to use its formal name, is a progressive and long-term lung condition without a cure. Patients suffer from conditions like bronchitis and emphysema, which make it difficult to empty air out of the lungs because the airways have narrowed. Exposure to tobacco smoke and other inhaled toxic particles and gases are the main risk factors for COPD. Treatments for COPD include inhalers and tablets, and for a small number of people, surgery or a lung transplant. Unfortunately, it's estimated that up to 2/3 of people with COPD remain undiagnosed. And I cannot emphasise enough the importance of early diagnosis and screening to make sure that those affected with COPD receive the treatment that they need. Last year, Chest, Heart and Stroke Scotland launched a report showing variable levels of support and treatment available to people in Scotland living with conditions like COPD. They focused on pulmonary rehabilitation. This treatment helps improve people's physical and mental health and also saves the NHS money by reducing hospital admissions and halving the time spent in hospital. They found that an estimated 69,000 people in Scotland would benefit from pulmonary rehabilitation, but that the provision of the service was a postcode lottery. We supported their Right to Pulmonary Rehab campaign, which called on the Scottish Government to ensure that people across Scotland got the treatment and support that they deserved. And also today, I would like to tell you about a group that are often unseen within the patient community. Bear with me while I get the name right on this. Those with alpha-1 antitrypsin deficiency, more commonly known as alpha-1. We'll go with that. It is a rare, and inherited condition which makes people very susceptible to developing COPD. And it's thought that around 25,000 people in the UK suffer from it. People with alpha-1 lack a protective enzyme. This makes them much more vulnerable to the effects of inhaling smoke or toxic materials like dust, fumes or chemicals. Patients are often misdiagnosed and receive treatment for other respiratory conditions like asthma. And around a third of patients experience a delay in diagnosis of more than 7 years after the initial onset of their symptoms. In 2012, the Alpha-1 community established the Alpha-1 Alliance, a group of patients and doctors from across the UK. They work to raise the profile of the unmet medical needs of Alpha-1 patients, as well as campaigning for better healthcare services. Ensuring that patients received adequate healthcare is something we should all work towards. On a personal note, Presiding Officer, I understand only too well the effects of COPD and what it can have on someone's life and their families. My dad was diagnosed with COPD about 15 years ago, and we didn't really know what it was, so I googled it to see what it said. And to be perfectly honest, at the time, it seemed to be doom and gloom. It wasn't until I researched it more, I understood that there were things that he, his GP and us could do, and my family, we could do to help him. My dad did eventually have to be on oxygen 24 hours a day, but that didn't stop us from doing family things together, like trips to the shop, into the town and family events. My dad is no longer with us, but I want to make sure that during my time in this place, I do all I can to highlight how to prevent and manage this condition. I would also like to commend the British Lung Foundation for the work they do to raise awareness of COPD and to help ensure that people across Scotland get the treatment and support they deserve. In recent years, they have had many achievements, including championing smoking bans in public places, better oxygen services for patients, and getting a great provision of pulmonary rehab. Efforts to reduce the burden of COPD are also taking place worldwide. And although there is no current cure for COPD, actions take place at any stage of the disease by a variety of people in many types of settings. These include smoking cessation programmes and fighting against both indoor and outdoor pollution. And I've visited a few groups in my local area that encourage people to go to singing classes and do things like that, and just very minimal exercise. And I did sing a lot with my dad when he was not well. So I don't have a great voice. He did. I don't. But to finish today, Presiding Officer, I would once again like to emphasise the need for early diagnosis. There are treatments to help patients breathe more easily and help keep an active life. So it is vital that they can get an early diagnosis so that they can access them. World COPD Day gives us a chance to highlight a condition that affects too many patients and families like my own. We should evoke this year's theme of World COPD Day and work together to help patients get the recognition, support and the treatment that they deserve. Thank you.
Thank you very much. I call Emma Harper to be followed by Alexander Stewart. Ms Harper, please.
Thank you, Presiding Officer. World COPD, November 20th was yesterday, and I'm pleased to speak in this chronic obstructive pulmonary disease debate and congratulate Annie Wells, the Parliament's COPD champion, for proposing this motion. As convener of the Lung Health Cross-Party Group and still a registered nurse, raising awareness and promoting respiratory health is an area of policy I'm passionate about. It was my big sister, Phyllis Murphy, who's a nurse consultant in respiratory medicine, who suggested that a lung health CPG should be created. And who's going to argue with your big sister? She has been an active, supportive and crucial member of the CPG since its inception, and much of her professional work is with persons who have COPD. I'd also like to thank the organisations and the individuals who provided briefings for the debate, and thanks also to Catherine Byrne from Chest Heart Stroke Scotland and BLF's Frank Toner for excellent CPG support also. You are invaluable. The BLF have promoted lung health champions, and we now have 10 MSP champions in this Parliament. Presiding Officer, COPD is a progressive and long-term lung condition with no cure. COPD is an umbrella term used to describe several lung conditions, including emphysema and chronic bronchitis. Cigarette smoking is recognised as the primary cause. It affects about 140,000 people in Scotland and many more not yet diagnosed. One way to describe how COPD feels is if you try to breathe through a straw. Inhale, exhale, inhale, exhale. It's hard work to breathe efficiently through a wee straw. This is how folk with COPD feel. The increased work to move air in obstructive lungs causes breathlessness, tiredness, coughing, and often other symptoms such as depression and social isolation. Presiding Officer, during my first year as an MSP, I brought forward a debate on World COPD Day in November 2016, and I started with the words of Sir Michael Marmot, who was at the forefront of research behind the British Lung Foundation's Battle for Breath report. Sir Michael said, "Breathing is something we all do, day in, day out, every day of our lives. It's so innate that most of us rarely stop to think about it." And in the debate in 2016, several asks were made of the Scottish Government and to take seriously the recommendations from clinicians and patients. So I'm pleased that since that debate, the Scottish Government is delivering Better lung health for the people in Scotland is high on the health agenda. It is worth noting steps which have been taken since the November 2016 debate. One of the CPG asks was for a respiratory quality improvement plan. In 2017, the Government announced a lung health task force led by NHS Tayside consultant Dr Tom Farden. And there was work done and must be acknowledged by Dr Ian Small and Phyllis Murphy for their work ahead of this announcement. Dr Farden has engaged with NHS expert clinicians, patients and stakeholders, and I'm aware that there will be a Scottish Respiratory Action Plan presented imminently. So I'm looking forward to the content of the plan, including recommendations for persons with COPD. And I will welcome Dr Farden to the next Lung Health Cross-Party Group, which should be around about February next year. And I encourage the Parliament Lung Health champions to come and join us at the next CPG. Presiding Officer, South West Scotland has one of the highest rates of COPD in the country. In 2017, I had the privilege of launching the Breath project, which is the Borders and Regions Airways Training Hub, led by Dr John Lockhart and Dr Lachlan McGarvey. Breath is an ambitious collaborative research partnership between Dundalk Institute, UWS, Queen's University and both NHS, D&G and Ayrshire and Arran. The cross-border project secured €7.7 million Interreg Euro funding and has a mission to investigate causes other than smoking, treatment and prevention of COPD. And I'm due to accompany Dr Lockhart to a local primary school so that we can teach young folk best ways to prevent lung health in the first place. Presiding Officer, I welcome this motion today by Annie Wells. I was going to touch on pulmonary rehab, but the time is running short. So I thank the Scottish Government for taking Respiratory Action Plan forward, and I look forward to its content and delivery. And again, thank Annie Wells today. Thank you.
Thank you very much. And I call Alexander Stewart, to be followed by Monica Lennon. Mr Stewart.
Thank you, Deputy Presiding Officer. I'm delighted to be able to take part in this debate and congratulate my colleague Annie Wells on bringing this member's business to the Chamber. As we already heard, chronic obstructive pulmonary disease, CPOD, consists of a number of conditions, including bronchitis and emphysema, which makes it difficult for individuals to breathe. The conditions is unfortunately progressive with a long term and without a cure, and we already heard that over 140,000 individuals in Scotland have it. However, these figures can be even higher because many do not know and are undiagnosed. And without optional treatment, progressive lungs reduces the quality of the life for these individuals. I am honoured to recently have been nominated by the British Lung Foundation as the smoking cessation champion at the Scottish Parliament. And whilst it is widely accepted that not all and everybody who's living with or more than one COPD condition has been a smoker, it does have a massive impact if you are a smoker on the condition. And I am delighted to also be a co-convener, along with Emma Harper, of the cross-party group on lung health. And that is a very progressive group that's done a huge amount of work over the last year or two in this Parliament and continues to do so. And I've met many individuals and organisations that have come to that group. And I pay tribute to the fantastic work of Linda MacLeod, who got her BEM for her involvement. And that's for Breathe Easy Clackmannan, an area within my own region. But I also pay tribute to those in Perth, Fife and Tayside who also have Breathe Easy groups that deal with. They do tremendous work in supporting individuals who have conditions and supporting their families and members to support that. And it's fantastic to find out that Breathe Easy Clackmannan has been nominated for a Queen's Award for volunteering, and I wish them all the best with that as that progresses. Breathe Easy Clackmannan is a group, as I say, that has done so much to involve and to participate. And we recently joined together with the Lung Foundation when they called on NHS Forth Valley to guarantee the future of Pulmonary Rehabilitation Centre in Clackmannan. Of course.
Rachel Hamilton.
I thank my colleague Alexander Stewart for taking an intervention, and it's a really important point that I wanted to bring up today about my constituent Jock Shields, who is from Eyemouth, and he lives with COPD, and he set up this fantastic exercise and social group at the Eyemouth community pool. and he's doing so much for hundreds of people across the borders who suffer with COPD. And I just wanted today to mention him because he's done such good work. Thank you.
Alexander Stewart.
Thank you, and I concur. As we all know, there are many individuals across our constituencies and regions who really go that extra mile to support and ensure. And as I say, Breathe Easy Clackmannan is one of these organisations. So it was with great difficulty that we found that the pulmonary rehab unit at the Forth Valley Hospital was to be relocated, because that has caused some real issues for individuals living with that disease across Clackmannan. The relocation of the service meant that the video conference option was no longer available, and that has offered them some difficulties with the programme as they go forward. Estimates suggest that over 3,000 people in the Forth Valley area could have benefited from the pulmonary rehabilitation. Pulmonary rehab is also cost-effective for the NHS as it reduces the risk of hospital admissions. On average, pulmonary rehab costs around about £130 per patient, but if they are hospitalised, that is in excess of £2,600. I'm deeply concerned at the relocation of this unit across the system, and as I say, I pay tribute to Linda MacLeod and others who have fought violently to ensure that. With 6% of deaths in Scotland last year attributed to the chronic disease, the quality of individuals has had to be impaired. So, Deputy Presiding Officer, it's crucial that the pulmonary rehabilitation centres that we do have are used and give that opportunity. I have already heard of the theme that's going all together to end COPD, and I very much welcome that. So in conclusion, Deputy Presiding Officer, the healthcare providers, families and patients and policymakers and employers and employees, it's vitally important that we work together to make a positive impact both for the patient outcomes and for the ending of COPD for good. Thank you.
Thank you. And I call Monica Lennon, last speaker in the open debate. Ms Lennon.
Thank you, Presiding Officer. I'm really pleased that Annie Wells has secured support, and so much support. I had a look, and around 40 MSPs have signed a motion, and that gives me a lot of heart, because the theme is all together to end COPD, and I hope that that strength in numbers is a sign that we are committed and we will remain united even after today's debate is finished. And I know that Annie Wells has a close personal interest, and it was lovely to hear her talk about her dad, and I'm sure he is very proud of her, even if she can't sing. But we haven't heard that yet, so maybe another time. But we have heard that COPD is a condition which narrows the airways. It's a chronic condition and there is no cure. And for those people who are living with it, often they feel very excluded. They find it difficult to keep down a job and to enjoy leisure time with friends and family. And I was concerned to learn from Chest Hatch Stroke Scotland that the number of people living in Scotland with COPD has increased by a staggering 26% since 2011. That could partly be down to getting better at diagnosis, but there are almost 140,000 people in Scotland living with COPD, and that is a big number. And we know at the moment that current treatment is focused on controlling symptoms through exercise and through inhalers, which can provide temporary relief from the worst symptoms. But I'm also really pleased that the British Lung Foundation continue to do excellent work to understand more about the disease. And their research is currently looking at how we prevent the advance of COPD. And I was really pleased to sponsor an event for the British Lung Foundation Scotland a few months ago. Emma Harper has mentioned that there are 10 lung health champions in Parliament. I'm proud to be one of them. And I think the work that the cross-party group on lung health is doing is really great. And again, I thank Emma Harper for bringing her expertise and her passion to the Parliament on this issue. But many of us have talked about already the benefits of pulmonary rehab, which is a combination of exercise, education, advice and support. We know it's both clinically and it's cost effective at helping to reduce hospital admission. So we really need to get behind this, ensure equal access across Scotland. In my region, Central Scotland, happy to, yeah.
Emma Harper.
Thank you. Thanks for taking my intervention. You mentioned pulmonary rehab, but would you also agree that singing or joining a choir is a great way to improve lung health? And we've had 2 lung health choirs in this Parliament in the last couple of years as well.
Monica Lennon.
Yeah, absolutely, and it's important that people know what options are available in their own community, but it's easy to get to. So absolutely, it's great to hear about these examples. In Lanarkshire, there's over 9,000 people living with COPD, and they would benefit from pulmonary rehab. It's not available at the moment. So again, I would press that point to the Minister. We do agree with Chest Heart Stroke Scotland that the upcoming respiratory care action plan should make this commitment. I want to just move on because lots of points have been made and they've been well put, but there are about 4 times as many hospital admissions for COPD among Scots from the most deprived areas compared to those from the most wealthiest areas. So it is a huge issue of inequality, and the NHS does need more investment to deal with that. I'll finish by agreeing with Jane Clare Judson, the Chief Executive of Chest Heart Stroke Scotland, who says we need to see urgent reform to help people to breathe better and really live life to the full with COPD. Thank you.
Thank you. And I call Joe Fitzpatrick to close to the Government. Minister, please.
Thank you, Presiding Officer. I'm delighted to contribute and respond on behalf of the Government on this important debate, and I want to thank Annie Wells for lodging the motion and to all those who signed it to make sure it could secure time in the Chamber, and also to thank members from across the Chamber for all of their contributions, particularly those who gave us some personal contributions. This debate, as we've heard, allows us to recognise World COPD Day, which took place yesterday. And as we've heard, the theme is all together to end COPD, and that emphasises the fact that so many people are involved in the fight to end COPD. I'm delighted that today we're joined up in raising awareness of COPD across the Chamber. At every stage and at any age, there is an opportunity to prevent or treat COPD. Care providers, families, patients, politicians, policymakers and third sector, everyone can make an impact. In particular, I want to commend the work of charities like British Lung Foundation, Chest, Heart and Stroke and others for the important work that they do to support people with COPD, their families and their friends. We all recognise that prevention and early intervention are key to minimising the prevalence and incidence of respiratory conditions, including COPD. Since I was appointed as Minister for Public Health, I've learned a great deal from speaking to health professionals and patients with COPD about the challenges that they and their families face. I've also learned a great deal about the underlying causes of COPD. My approach is to make public health and the health of the nation relevant and essential for all parts of the Government's work. Very quickly.
Monica Lennon.
I thank the Minister for taking the intervention. One of the issues I wanted to raise with him briefly today was around people who are living with COPD but also have either an alcohol or drug addiction or both, because sometimes we don't see that whole-centred approach. It was a factor in my own father's death, and I just wonder if the Government's doing anything around that. Minister.
I think Ms Lennon raises a very important point. Very often people have a range of comorbidities, and it is really important that when someone comes with one condition that we make sure that we're looking at all of the conditions and supporting them fully, because that's how they'll make full recovery if that's possible, or get the best results if full recovery is not possible. So I think this is really important that we look at all of the underlying causes of COPD going forward. So Emma Harper highlighted the British Lung Foundation's Battle for Breath report, which highlights the strong links between lung disease, deprivation and health inequalities. It outlines the main environmental drivers of lung disease, smoking, air pollution and occupational hazards, and explains how socio-economic status affects exposure and outcomes. So we know that the vast majority of COPD cases are smoking related. Our Tobacco Control Action Plan, published in June 2018, sets out our 5-year plan to address the ongoing harm that smoking causes in Scotland. We're determined to tackle the inequality of smoking, to prevent the uptake of smoking amongst young people, and to provide the best possible support for those people who want to give up. We've introduced a 2034 tobacco-free target. Our aim is to reduce smoking rates to 5% or below by 2034. 34, creating a generation of young people who don't want to smoke and are protected from the harms of smoking. We're really pleased that we're making some real progress on this. Fewer than 1 in 5 adults now smoke, and over time we'd expect this reduction to have an impact on the prevalence of COPD. But as I think Annie Wells said, it's important that we don't forget that there are other causes of COPD, and alpha-1 antitrypsin deficiency being one particular area where I think at the debate that Monica Lennon was talking about, we talked about the research into that area, and that research will provide us with a better understanding of why it is that some people are more likely to develop conditions such as COPD. And we know that COPD may develop due to long-term breathing of harmful substances such as fumes and dust, but that research will give us a better, wider understanding. I think absolutely everybody, I was about to say just about everybody, absolutely everybody, Annie Wells, Emma Harper, Alexander Stewart and Monica Lennon, all mentioned pulmonary rehabilitation. And in the past 6 months, we've had 3 debates on respiratory conditions, and pulmonary rehab has been central to all of those. And we've discussed raising awareness of the condition, diagnosis, education, e-learning, resource, data, special nurses, research, and much more. But as I say, in all of our discussions, one issue has come across as a priority, and that is improved pulmonary rehabilitation. And I've said many times that we recognise the importance and evidence of pulmonary rehabilitation in helping to support self-management. It's already a key recommendation in national clinical guidelines, but we want boards to increase patients' access to this important programme. We need to understand where there are gaps across the country as part of that. So we want to work on examples of best practice and test them in areas where improvement is required. We're going to do this through the implementation of Scotland's first ever respiratory care action plan. As promised, the draft plan will be published for consultation before the end of this year. We know that true change will only happen through working with others, hearing from their experiences, good and bad, and learning about what we could do differently and what we must do better to make a difference that people need. That's why I would encourage as many people as possible, once the draft plan is launched, to respond to the consultation. The plan's been developed, the draft plan's been developed in collaboration with clinicians and with others working in the sector, including the third sector. So I think it's already in a good shape, but it's really important that we hear directly from people about their thoughts on whether we've got the plan right. It's a genuine consultation. So my huge gratitude goes to everyone who's already offered their invaluable contributions to developing the draft plan as it is, but also to everyone who is going to hopefully give us their input during that consultation. And I'm sure that will include the cross-party group in February, when you'll be able to discuss the draft plan and feed in. And I can reassure everyone in the chamber and the cross-party group that this is a genuine consultation, and we will listen to all those views and input into that plan as we take the plan forward to final publication. But for now, Presiding Officer, thank you very much to everyone for your contributions on this very important debate. Thank you.
Thank you. That concludes the debate, and I suspend this meeting of Parliament till 2:30.